Hi, Anchit, how are you?
Hi, my name's Anchit. Thanks for agreeing to talk to me.
No problem, man. No problem. So, you're in Cleveland area?
Yeah, I'm in Cleveland, Ohio.
Okay, okay. My sister is actually in Willoughby.
In Willoughby? Okay, that's not too far from here, I believe.
Yeah, she's not that far at all. So, you're thinking about putting together a franchise, right?
Yeah,
Um, so when you're looking into doing your franchise, right? So what you're doing is you're doing your competition matrix right now. You're trying to see if it's a viable thing in your area. My
yeah,
first question is the franchise that you're getting into. Do you already know which territory they're giving you?
yeah.
Okay.
It's
So are
Cleveland
you going to
West.
be yeah, so you want to know the territory because when you're starting to figure out is it going to be a viable area, the last thing
Mm,
you want to do is like do the whole Cleveland area and then you get the wrong data.
right.
Okay.
So I can, you know what? Can I share my screen? I can
Sure.
show you what I have, right?
Sure.
Like, don't tell them
Of
I
course.
showed you. I'm kidding, but I can basically show you what I have, right? So share. Let me go ahead, right? So this was the Excel file that they provided me with, right?
Okay.
This does a data analysis for your city, and this is a first pass at it. It's not detailed. I need to be further in the process to be detailed, but I'm doing my own research now at this point, right? To
Mm-hmm.
kind of satisfy my own curiosities. So overall, like as you can see, the population of Cleveland West. So if I went to so if I show you this, right, Cleveland West, let's just say, right, you can see a map. So let me click here. So it would be pretty much, so this is pretty much, oops. Maybe I've got, so actually let me zoom in a little bit. It's this part basically, this part till about here, this whole region here. And like the line would be in the middle and then it's Cleveland East. Nobody has the Cleveland East territory either. So one of the very big advantages of this franchise is it gives you large territories. They don't really, because it's a small franchise. That's why I kind of liked
Mm-hmm.
their value propositions. The 702,000 is the population. From what I've heard based on my research, typically your clients are aged 75 or over most of the time, 70 or over sometimes, right? 65 and over as well, but your majority of your clients are going to be in this range. So there's a good number of people that are 75 to 84 and 85 plus. It's not too little, but what concerns me a little bit is the median income here is not super high. But obviously, Cleveland's not an expensive place. But if I look at the median household income, right, I would have to assume you have to your household income must be above 75K for you to be able to afford home care, I would think. I don't know. Like, that's just
Yeah.
just
For a senior, they need to have a income, above 60,000 to kind of make sense of affording home care services.
Hmm.
Um, the other demographics we look at is also the people over the age of 45 to 65.
Okay, like give me 1 second. I need to make notes.
Mhm. Sure,
So
sure.
this is actually from your YouTube,
No
your
problem,
YouTube.
no problem.
The
So the reason why I'm saying you want to look into the age of 45 to 65, because the reason why the people in that area are the ones that are going to pay for most of the time the home care services for their loved ones.
Okay, so for seniors themselves, give me 1 second, please.
Sure.
For seniors themselves, above 60K, let's just say aged above,
Above
65,
65, yes.
right? For uh, for what was the age, like 40 to 60, right? Like my
45 to 65.
to 65.
Because if you look at it, the 45-year-old will probably have a 70-year-old mother or father. The
Right.
65-year-old, they're still kind of thinking about retiring sometimes, and then they have somebody who's, who is 85, 95, right? So
Right.
so those are the two kind of areas we look at. Now, of course, for the age 45 to 65, we're looking at people that makes above 90,000.
Right. Oops.
And the reason for that is those are the people that can afford have extra money to pay for mom and dad while they take care of their family as well.
Right. So at least 90K, right. Yep, makes sense. And a low income, I mean, a low cost of living, that's a pretty low cost of living. So I would assume that, this amount would be okay. Like with 90K, you can not only take care of your family, but you can also take care of your parents as well because the cost of living.
Exactly. And we use that number, especially when we're doing Facebook marketing, because we do a lot of transactions through Facebook. There's Facebook ads. It's more extensive than just a basic, let me boost my post type of stuff. So within Facebook, we can do ads in there, and we can target people depending on how much they earn. So if we're able to do that, which we do it for a lot of agencies, we can put education stuff out there and say, hey, do you have a mother who is needing more help at home? And so we can target it that way. So that's where you kind of want to be able to look at as well. Now, yes, it is a little alarming that, in your area, the income bracket is a little bit low for those aged seniors. And the problem with that goes on is you have to look at your business plan as an agency, meaning that in your agency, are you planning to go for the out-of-pocket people, or are you going to kind of create your agency to work around Medicaid or those additional services?
No, we're looking at out-of-pocket people. Like that's the problem. That is not
great. Great. So, that's a good thing to know, right? Because even for us, our agencies, we don't go after, the lower paying clients. Not to say that we don't want to give them services. There's a lot of agencies that's going to try to fight for those bottom clients. I would rather go after the ones who can afford $25, $26, $30 an hour for care for mom or dad, because they can pay. And we've also established that people that are able to pay for services are the less likely complainers. The one who's always trying to budget, trying to save money, those type of clients, unfortunately, will have more complaints.
Right. See, the other thing that concerns me here, right, when I look at this is my biggest frustration right now.
Sure.
Look at the number of, this is all of Cleveland, right? The city of Cleveland, basically. Just look at the number of home health agencies. That's a lot of competition. It's ridiculous. But according to my franchisor, he's like, it's still not, obviously he's going to say that, right? But they seem like very good people. And according to them, it's still not so much that it scares me. He's like, it's not something that like you expect to see your visiting angels, your home instead, your comfort care, like your big players. If they're not in the market, that means something's wrong with that market. That's why they're not there. So you expect to see the big players, but what concerns me is there's just so many small ones as well, that there's so much competition, and that's kind of also keeping me, I'm not sure whether this market is saturated or not, whether there's still enough demand. Like that's what I need to do. I need to get involved in the community a little bit more, and I need to just get out there and that's what I really need help with. Like, how do I myself, not from data, right? There are a lot of hospitals here. Cleveland's a major medical center. There's a lot of hospitals, a lot of referral sources. That's not really the problem. The problem is there's a lot of competition, and I just don't know if there's enough high income population, the type we're looking for, to be able to pay for home care.
You can do a lot of consensus and go into the market and going into public and trying to do networking and meeting people, right? But it's at the very same time, it's very, very limited information that you'll get. You're going to hear people say, yeah, I know a lot of people that needs care. But the problem that goes on with that is people are saying, I know a lot. Well, if I ask a question, it's like, what do you mean by a lot? One person might say 3 people, the other person might say 10, right? So, it's good to network. One thing I would always look at into networking is going to Alzheimer's associations, going into open houses with assisted living facilities. I would reach out to a lot of the, you're doing non-medical, right? So I would
That's a
even
good
reach
way.
out and network with home health agencies that provides medical services. Because you'll be surprised, you'll get a lot of referrals coming from them, because a lot of them don't even deal with out-of-pocket expense patients, like non-medical. So a lot of referrals will come from them as well. But I have to ask this one question. What made you decide to actually franchise a company?
So basically, the way this year, right, one of my goals was to try to create a second stream of income. So I was looking at, either franchising or real estate, something I wanted to do something. So I started studying franchising. Jan and Feb, I read a few books about it, and I went through a bunch of franchises, and all of them just seemed like the business model was such that it would make money for the franchisor and not for me as a franchisee.
Mm-hmm.
And I would just be a glorified manager, basically. You don't really have any. But this one, so then I came across this home healthcare one. Then I studied home healthcare, and I learned that there is a lot of potential in the future in this industry because of the demographic, right? And then I came across a very good franchise, actually, in this case, where at least I think they're very good so far. They are a small franchise based out of San Diego. They have only 9 or 10 franchisees. Everyone's who I've spoken to has given them a 10 on 10. Like, every time I've spoken to them, I've gotten a lot of help. It's like a family-owned franchise. They aren't big. They're small, so you get a lot of individual attention from them. Basically, they'll give you a lot of attention to make sure you're successful. And they have a good model. They don't ask for a lot of money. I don't have to pay them some excessive royalties or anything. And the other thing was, home health isn't something as simple as a cleaning, painting LLC, where you're going and painting someone's house or something like that. It's a little more complicated than that. So I figured, at my age, I'm not in the healthcare industry. I'm an engineer by trade. And I figured it would make sense to go get a franchise. So I don't have to put the building blocks in place in terms of the system. At least, there is a customer relationship management system. There is that whole experience. I have other franchisees I can talk to, and they already know, like, they have a business plan. They've made the mistakes, so they know how to reach out to, for instance, even staffing, right? They were like, we were going to target like nursing homes to begin with, actually, and provide staffing for them, because you get 1 or 2 good big nursing home you get 1 or 2 big contracts like that, and you're suddenly, you can get off the wheels faster when you start your business, as opposed to individual clients. Home care is going to be your primary thing. Private individual clients would be your primary thing, but that's a big. So this knowledge I don't have. So I figured that being able to, one of my alternate things was I could learn about it a lot myself and then build it myself. But I have a full-time job as well, which I can't quit. I can't leave my job either right now. So I kind of need to, till this thing grows into something, I kind of need my job to pay for my expenses and all of that. And so I figured franchising is a safer route, let's just say. I still have to do all the work, obviously, a lot of it, right? And this is a more passive model as well. I'm going to be paying them a management fee. So where they manage my people as well. So this seems like a good option for me. But what do you think, based on what you heard from me about the whole franchising thing?
Well, franchise models works better for people who've never been in the industry. So you are coming from the outside of the industry and jumping in here. So, the franchise model always works well with those. You definitely want to be able to get into, a good area first, which is, that's the most important thing. The next thing also is, there's the pros and cons to both. Pros and cons is, you hopefully have a system involved already, a system created. If you signed a non-disclosed agreement already with the franchise, if they give you an authorization to speak to the other franchisors, I think that would be an important thing, because you want to be able to say, hey, and the real question that you want to ask the franchise organization, the one who franchised a franchise, is how do they support you with marketing? Because it really doesn't matter. Like, I can say, for example, Visiting Angels, Comfort Care, any of these other companies, I'm going to look at how are they advertising.
That's the main thing. See, the plan for us was we have to hire a local business development person,
Mm-hmm.
right? There's no option there. You just have to obviously hire us. Then this is my base expense. If you look at my working capital, my biggest expense is a business development person, a good
Yes.
quality, high quality person, right? And they obviously would manage him. They would make phone calls themselves as well to
Mm-hmm.
nursing because they've done it for a while, right? The way this person he's the president of this franchise, right? And I've spoken to him, the way he can sell it, I can't sell it like that because I'm just not in the industry. Like if I call a hospital or if I try to get a referral myself right now, I would not do a great job. I would educate myself. I've learned a lot about this business now, but still the way he would sell it, like he's a huge asset in my opinion. If I can get him on my team, this president that I'm talking about, if I can get him on my team, that's great. And the way to get him on the team is to pay him the franchise fee. So that's how. But I need to get into details with that. They've said that they will manage because I'm paying them monthly actually. My first year is going to be a management model, is what it's called. Like it's a fully passive model. Basically, I will be involved a lot as well because I want to learn and I want to make sure this is my business at the end of the day. But what they do is they have 2 or 3 experienced people that are going to manage my team. They will manage the caregivers. They will manage the business development person I have over here. The plan is to get like a director of ops, just one employee. That's it. One full-time employee who pretty much does marketing full-time really. But at the same time, he'll manage some other small aspects as well. So I'm going to do all the billing. I'll handle that aspect of it. And obviously then the team is there as well. The management team is there as well.
So you'll have a virtual marketing manager, a virtual company manager, like in San Diego, and everybody reports to them. So you're paying them. So you're not paying, if you start bringing patients or clients, you're not paying that 3, 4, 5% franchise fee. You're paying them a management fee.
I'm also paying them a 5% fee. It's a royalty fee. It's not, I don't have to pay them for the first 6 months of the business, but after that I do. But I'm paying them a management fee separately because if you think about it, and let's just say I don't pay them. They have multiple models. They said you don't have to do the management model, but then you have to be fully involved. But if I have a full-time job and there's a business development person here, right, who's doing this thing, and I will be involved a lot, right? Otherwise, I wouldn't be sitting here on Saturday and researching this as much as I can be, right? But I may not have the experience, number one. Number two, I may be at work and I'm dealing with a very high priority thing and I may not be able to just pick up the phone at that time and pick up a call. So first year, if I pay, I don't even care if I don't make a profit the first year. It doesn't, I don't care if I even lose money first year. I want them to build this up in the first 12 months to a point where we have a system together properly. We have some sustainable clients. We've gotten our feet into the market now. And at that point, I'll stop paying the management fee. That's my plan. Get it to a point where at least it's breaking even. The working capital that's required, the expenses, that's the business development person, your professional licenses. Like I've done all the math. I can show you, right? So where is it? ABS investment sheet. So here's what it looks like, right? This is what my monthly expenses look like now. Advertising and marketing, this is just for like goods and stuff. If you have cards and stuff like that, any marketing material. Insurance is expensive, workers' comp 9.5%. I'll run this out of my office, so no office rent or utilities. Internet and phone also have exaggerated $300. I have internet, phone already. Office supplies, 50 per month. Software technology, there's a specific software we use as well. So that requires 250, any meal services, blah, blah, blah. Then this is the big expense, payroll for a employee, right? That $5,000 a month. This is that big expense that I'm looking at, like a business development person. So I see my estimate at 8,700 per month. And the billing here, I've called the big players here and asked them, like I said, I have a grandmother that's ill or whatever, and then she needs care. She's going to be coming from India. Can you please let me know, what do you charge, and so on and so forth. People here typically charge $23 to $24. That's what Visiting Angels or Comfort Care, that's what they charge their client. And a caregiver, they are paying them 10.5 an hour or 9 to 10.5 an hour. I would pay them more because I want to make sure I get a bank of caregivers. So then based on that, I was looking at I need 1,150 monthly hours, monthly hours of caregiving, client hours, sorry, in order to make even basically. That's what I was looking at. So that's the math behind it. Now I have to figure out how can I get this 1100, can I get this 1150 hours of clients? Can I bill that much in 1 month? So
my one agency does more than that. So, and that's just a startup. So, I mean, if the best way to look at it, when you start seeing a big number, such as 1150, you want to break it down even further just to be able to help you make more sense. So, let's say the average person you provide care is at 50 hours a week.
okay.
So that means, 50 hours a week, let's just make it even 40, just to lower it down. 40 a week. So that means if we provide 40 hours of care for a person a week, that's a total of 160 hours in a month. Then we'll break it down, we'll drop it down a little bit to 150. So 150 hours. So now you take that 1150 and you divide it by the 150, and now you're going to be able to see how many patients do you really need in order to be able to make sense of things. Because sometimes when we start looking at those 1150 hours, we more look at the 1150. So kind of break it down even further to say, okay, well, you know what? I guess I just need 10 patients.
Right. So that's where I'm at here, right? So break even to meet 1150. And they said, assume an average client. This is other franchisees told me the same thing. Like, assume an average client will charge you, let's just say 24 hours per week. That's what they went with. I know you're mentioning 40. So based on 24 clients per week, I need 24 hours per week. I need 12 clients basically to break even. That's what
10 to 12 clients. All right. So that's the thing. So you need 12 clients to break even. So the question with that is there people in your area? Now, the business manager that you're bringing in, is it coming from the company itself, or you have to hire that person?
They will hire that person here, and obviously I will be fully involved in hiring him, but hiring him or her. But yeah, that person has to be local, right? So they would help me hire that person. They would train him if needed. But they're wanting, like I mentioned, that guys, I don't want to pay this. This is killing me. This is killing me. Like, let's pay hourly, because I spoke to other franchisees that are paying 13 an hour, 14 an hour for a marketing guy. And then the president was like, man, listen, you can do that. That's one way of looking at it, 13, 14 an hour. But believe me, you're going to get an average marketer then for average money. Like, the way to do this is get a high quality person who's in the industry. He needs to be top notch, who can go out there and execute what we tell him to execute to the T and get you clients fast.
I don't mind paying somebody $5,000 as a salary. That's $60,000 a year if they can produce. My question is, if the franchise is going to be helping with hiring this guy, what if the guy does not produce? Do you suffer for that? Because the problem with that, when you hire the wrong marketer, I've seen marketers that are so good at marketing themselves as the right marketer for your company, and when they start going on the field, they're just really a bunch of idiots. And so, my question with that is, when you hire the wrong marketer, right? A lot of people can say, well, let's say you pay him $5,000, and let's say in 2 months, right, you fire him because you're like, I wasted $10,000. This guy's not producing like he's supposed to do. You didn't lose $10,000. You lost $10,000 paying this guy, plus, right? Plus, you lost that 2 months of gaining clients to make profit. So you back yourself up even more. So really the truth is, if this person's supposed to bring in this much amount, if somebody's supposed to bring $5,000 a month, right? That means every month, first, second month, he should have brought 12 clients each month, and he didn't do that. So now you really lost $30,000. You lost $20,000. The next thing that you have to look at is you need to hire another marketer. So with that said, you're going to buy yourself another 2, 3, 4 months later on.
Right.
And that's the thing. If they're willing, if that's what they want you to hit it with, that's fine. But you're going to hire this person. He better produce. And if he doesn't, what's going to happen? Because you're the manager of my company right now. You're paying money to them to manage. So are they going to produce for you? Okay. Like, I don't mind, like I said, paying $5,000, but my thing on what I would do is, show me, don't tell me. Meaning, here's your base salary. right? And then you have potential to make more money depending on bringing in more clients.
That's what
right?
I'm going to do.
I'm not going to pay some, you know, if I start hiring somebody for marketing for home health, home care and pay them 13, 14, that's really not going to attract somebody to move to your company.
Right.
But there is that fine line, because if you're paying somebody $5,000 a month, that's $30 to $32 an hour. You're paying them for a 40-hour gig.
Right. Exactly.
You know, so I want to be able to, like, you know, say, okay, this is what you're going to do. So that's why marketing. And so if they're going to be part of this and managing the company, taking a management fee, and if they are managing your company, that means they're probably charging you $1,000 to $1,500 a month for management fee.
Yeah.
I'm guessing. Okay.
Yeah.
Okay. So that's how much they're charging you.
Right.
So, you know, with that said, you know, I want to be able to say, hey, what are you doing for marketing? Like, I know if you do a search in your area right now, do it right now. For example, go to Google and search home care in your area.
That's just shit done. Like, these are 1 second, sorry.
Yeah, sure. Just do home care, bam. All right. So right there alone, I know Right at Home is paying ads right now to be on the top of the triple pack. I know Journey Ahead Home Health Care Agency is placing ads. And Journey, for example, is not really a franchise. I've never heard of them before as a franchise organization, but they're willing to spend some money as well to put them stuff. My question is, that's Right at Home using the money that they're getting from the franchisees to put ads out there.
Right. So let me do one thing. From a social, so all of this they're supposed to do, right? This is all part of my investment fee that I give them, right?
Mm-hmm.
Initially they're supposed to do all this, and apparently according to all the franchisees, they do this. You know, they'll make sure you're up there, and like they'll make sure you're up there with the social media marketing, like with Google search and all of that. Like, they handle that SEM part, social search, and
let's prove them right.
Right.
Do you know a city where one of the franchisees is located?
Yeah, I know all of them actually. So,
okay, perfect. So go to
them
Google right now.
Okay. Give me 1 second. Let's do this. So, and this guy, right, especially where's the guy from Kansas? Yeah, Wichita, Kansas. So I spoke to him on the phone. His thing is on the FTT as well. He grossed, not grossed actually. Yeah. Sorry. His gross revenue last year was his 4th year in business was $1 million, over $1 million. And he made around 18% profit is what he told me, like, was his bottom line. So this guy made around 180K, but he's apparently a star. Like, you talk to these guys, all the other folks, I spoke to everyone basically, right? And they're like, man, this guy is just killing it. He himself goes and does the marketing, right? He's the director, he's the owner, he does the marketing himself. I don't know what his demographics are, but anyway, so let's search this, right? Wichita, Kansas, let's just say, right? So
let's not put their name up. I don't care about their name right now. Put Homecare in Wichita, Kansas. Because the name will pop up if you put their name down.
Right. See, I don't see it at top, but right, I don't see it. So
now, just to let you know, this is what we call the pill pack. The pill pack consists of three agencies that does really well with their Google My Business. So the first two is the first one you say Always Best Care Senior Care. That's an ad. So they're doing some pay-per-clicks. Now let's scroll down. So now, if we scroll down, we're not going to go there. Keep on going down. We're going to go in the real searches now. Here's the searches right here. This is where the truth happens. Is the company doing SEO marketing? Okay. Is his company going to go in the first page of Google?
Right. See, the thing is, right, with this guy though, specifically the guy from Wichita, Kansas, right? So I spoke to him. Let me show you this as well, right? Is it, oh, it might be on my other laptop, but I spoke to him, right, entirely about this. And he's like, man, listen, this is a business where, and he may be wrong, but he's making a lot of money. He's like, this is a business where you need, and he doesn't have the management model. He's doing it himself. It's owner operator. So he's not paying them that money or anything like that. He spends no money on Facebook marketing or anything. He's like, I get in my car and I go and build relationships myself. Like that's the advice I've gotten from multiple franchisees from this list. They're like, you will get some business from Facebook and stuff, but your primary is your referral sources. That's your main source. 95% of your revenue will come from that. You need to get in your car and you need to go build relationships. You don't go once, twice, you go 10 times to the same person. Maybe the 10th, 12th time, they'll start to remember you then. Like that's the advice I've gotten. Like you need a top-notch guy who goes and, does that. So it's up to me how I assign, where is that Excel? What I do with this, I can increase, this was originally 1,000, right? So it's kind of up to me what I do in the advertising and marketing area. So when I initially pay for this, there's a $4,500 marketing but I put that budget in for my initial investment, $4,500 for really getting your SEO and all of that done. Now, this is up to you how much money you want to put into this. Facebook ads, pay-per-click, blah, blah, blah.
Is that what they're expecting you to spend, or is that part of your investment with them?
They said around, it's your choice between 3,000 to 4,500 is what we recommend. But I want to go, at least at the start, I want to go all out with marketing, right? When it comes to the internet as well. So I said, okay, I'll do the maximum amount. They recommended like 4,500 max. You should be more than good.
Mm-hmm. So are you, how would I say this? Are they in charge of making your website, or do you have to make it?
They make the website. So it will be something like this, right? Better solutions, let's just say, 1 second, and then it'll say /Cleveland, something like that. So
yeah. So the thing with that is it's hard. If that's their franchise, it's going to be a lot harder to kind of put together SEO for yourself. They have to do it, and you have to trust that they know what they're doing for SEO.
Right.
Because what they're doing is, it's called a multi-site website, meaning that they're creating different sites for different organizations within the areas that they're in. So the main thing here is, like that gentleman you were talking to, it is completely correct. Largest amount of percentage of your referrals are going to be coming in from person-to-person marketing, from boots in the ground marketing. But then I will also say that he's wrong regarding Facebook marketing, because the reason why Facebook marketing doesn't work as much for them is because they really don't know how to do it.
Yeah, and they don't do it.
Exactly. So you cannot. Every time somebody says that, I'm like, well, did you do Facebook ads? Well, yeah, I tried one.
Right.
Try again. No. Did you test different markets? No. So you can't. When somebody says Facebook marketing doesn't work, I say they're completely wrong. They're just not putting enough effort in it. Just like, if you put effort in Facebook marketing, it's branding at the same time as you're letting people start knowing about your name of your company, right? That's the ultimate goal. So, looking at your numbers, I am concerned about the median income household. So that's one thing. The next thing that I would look into is how many nursing homes are in the area, how many senior buildings are in the area, not just assisted living facilities, but do they have like those 55 plus and over communities in your area?
Right. 1 second. So these are the hospitals. Give me 1 second, please. So adult care home. So he was very happy with this aspect here. So he's marked all the relevant stuff for me. So this is the number of assisted living facilities.
Did he give you the emails of these facilities?
Let's see. I can easily get them, right? Let's see. Yep, I have the phone number and everything.
How about emails?
I'm pretty sure I can get them, right? Let's just say I get them.
Yeah, I mean, it's just you want to start doing the basic introduction and do mass emails, and just start letting them know who you are. great. There's a lot of assisted living facilities. That's good to see.
Let's keep going because he has stuff probably highlighted, so I can maybe show you there's something else that may stand out to you, right? So let's go down. This is not really relevant. Then hospice care
For
is relevant.
hospitals, it doesn't affect me with hospitals because hospitals is a lot harder to get into.
Mm-hmm.
Because with hospitals, when you're trying to market to hospitals, you first have to get in front of their team, and then it's private pay. So just imagine having somebody who's not as enthusiastic about telling people about your company.
Mm-hmm.
It's just very hard to put that. So if I do market to hospitals, I have a different, of course, one thing for me is you want a different flyer for a hospital, to a nursing home, to an assisted living facility, to a patient's family, or to a patient. Each one of those brochures are different. Most agencies will have that one trifold brochure, but the problem with that one trifold brochure, who is it talking to? The marketing material needs to speak to the person who you're handing it to. If it's going to go to an assisted living facility manager, what's in it for them? How are you going to help the manager, not the patient for now, the manager? If you're going to go to a hospital, for example, especially for hospitals, I truly, truly tell people this: your marketing collateral should have the price of your services.
Right.
Because that's the first thing people are going to ask: how much is it going to cost? How much? And then so like what we do is for our flyers, what we do is we actually put our price and the competitor's price. Because we know they're going to call other agencies for services. But if we put their price there already, like, hey, we did it for you. Of course, we're going to do it on the right way. We're not going to lie. Number one. Number two is we're going to put the date that we obtained the information from them. So we're going to put those. So all those different strategies on how to market that. A franchise or a non-franchise home care company is going to do well. It all depends on you as an owner getting the right marketer to push your product. But at the very same time is not to forget the services that your caregivers are going to give as well.
Make sure you have top caregivers. I'm not as worried about, I know I should be, but I'm not right now, because it's a big thing, right? So I'm focusing on one thing at a time. Caregivers would be having a good bank of caregivers, and obviously they are the face of the company, right? The business development guy and the caregivers, they are the ultimate interaction with the client. So it's essential they are excellent. But right now, I have two big concerns as of this moment.
Awesome. What is it?
So number one is, how do I find out whether this market is saturated or not? Number one, and how do I start getting out there? I've done enough stuff on the computer, I feel like it's time to go out and validate some things now. And the number two thing is, how do I find a good marketing? I mean, they'll help me as well, but how can I be sure that I'll have a top quality business development person and I'm willing to even give up some equity for it? If I could find a working partner, that would be perfect. Someone who I give 49% to, I'll own 51%, and he runs the business though. And I don't mind. I can work the math out later, but even that would be ideal because then he has skin in the game. And at that point, then he does the marketing. I would love to do the marketing myself, learn, and then I'm not really a sales guy in my opinion, but still, I can't give up this job. It pays me too much right now.
Yeah. Never ever give up your number one income to a hobby right now. Right. When the hobby makes more money than your regular income, you have every right to get rid of the regular income. Okay.
Right.
So number one, your concern is, is it saturated, right?
Right.
Everywhere in the US, it's saturated. So I just want you to be able to understand that wherever you are, there are a lot of businesses, a lot of home care, home health agencies saturating the market. There's some cities that they feel it's so saturated that the state itself has stopped people from applying for service for these type of companies. Kentucky, New York did it for a while. Florida did it for a while. A lot of these states just said there's too many of these people servicing this area, so we're saying no. So it is saturated. The good part about that is just because you're seeing so many company names in that list of people providing these type of services, the question is, are they good at what they do? Are they good at marketing? There's agencies that have been in business for 2 years, 3 years, and they have 1-2 patients only.
Right. Even with the better solutions, right? There's this one guy. I think I closed it. Like I spoke to him. There's just some people are just not. They buy the. So this. There was a very good analogy that I heard that they were like, if you buy let's just say you bought a treadmill. You bought a treadmill, right? It's an investment to improve your fitness. But if you never use it, you're not going to improve your fitness. So this guy, Brett Miller, for instance, I spoke to him personally as well. Like his gross last year was $28,000. So this person, so I look at the FTD, right? That's the good thing with franchises. You get all your numbers, right? And they have to be official or you can sue them. So I see max at highest, right? 1 million something, 1,100,000. And then Brett Miller, 28 grand. I'm like, what type of a range is this? So I freaked out. I was like, man, that can happen to anyone. Then I called him and I spoke to him. He's like, just like due to personal reasons, I just haven't been involved at all. Like basically there's nothing going on here. And the franchisor has bent over backwards to help me out. But those were literally his words. But he's like, because of a lot of personal family problems, this business is open. There's nothing I'm doing about it right now. I'm getting back into it now. So anyway, but having said that, like it's a lot, like you said, it's a lot owner dependent. Like I have to do the job well. I have to have the right people. I have to build it properly. I have to do a good job of it. Otherwise, it's not going to work. But one of my things is I didn't want to get into something super competitive, because then you're like scraping for profits, like you're.
Well, here, let me give you for example, right? So, just like any company out there, your choice is how do you make yourself stand out and completely different, right? Everyone's going to provide home care services, right? But what are you doing that makes you stand out and different? Most companies will just compete on the price and they want to be on the lowest cost home care company, but that reduces their profits. It also reduces the chance of getting the right caregivers because they're paying them low. So you never want to be competing in price. So a good example, right? We do have a home care company in the Midwest. It's not in Ohio, just because my sister's there, okay? But, it snows. So one thing that we do that makes us stand out is we tell all these companies that, hey, just to let you know, we actually provide free snow plowing for any 1.5 inches or more on the driveway and the walkways of each one of our clients. The reason why we do this, it prevents fall risks, just in case they walk outside when we're not there, just because, so-and-so. So this is what makes us stand out. By us talking about that, no other agency does, but it's part of our fall prevention program. But at the very same time it's a service that we offer. Now, it doesn't apply to patients that are in assisted living facility. It only applies on patients that have a house or a townhouse. Right?
Right. Makes sense.
We provide free pet grooming on a monthly basis.
Pet grooming? Okay.
You'd be surprised how many patients have pets. So we tell them that, hey, we have a pet grooming program, a pet care program for all our senior clients. We take care of their senior pets. What we do is every month we provide, we wash the dog, shower, and everything. Every other month we provide somebody that actually will cut their hair. We bring in a mobile dog groomer. So we dealt with some mobile dog groomers and say, hey, we're going to get you some clients, but if we start growing a little bit, can we get discounts? I don't want a cut of the money. I just want to get a discount for my client because I'm paying for this. And so a lot of them will do. And so the dog groomer will go there, cut the hair. Once again, it's out of our pocket. It comes for free. But technically not, because the client paid for it. So we're trying to help them make sense of paying the higher rates, and to say, we're not just a home care company. We're a concierge organization providing concierge care. There's actually a franchise in Ohio right now that they're a franchisor, and what they actually do handyman work, but they created a second network of actually doing something. It's something, I think it's True Blue or something like that, whatever. But what they have is they have a senior program now where they actually provide handyman services for seniors. It's the same services, but they're just trying to say it's handyman work. We do the same thing for all of our clients. If one of our client wants, you know, a window, you know, a frame hung, we do a lot of that for them. So, you know, there's just so many things on how you can make yourself stand out.
So I need to be creative about this. And all these questions are, I'm going to obviously study this. And then these questions are going to go to the franchisor. I mean, dude, that's why I'm paying you. Otherwise, I might as well do it myself, right? Like they need to answer everything. If I'm paying you that amount of money, I want all the answers. Otherwise, I mean, I will find the answers myself too. I understand that. But I have high expectations from a franchisor at that point if I'm paying you, right? Otherwise, you have to answer that question. Like you said, why are you franchising? Do it yourself, right? So that saves me
exactly. And you know, so you know, I know a lot. I have a lot of friends who have a franchise home care company, and you know, hey, they did well with it. I mean, they're doing good. You know, we help them learn how to market. We show them how to do some, you know, some YouTube marketing, Facebook marketing, you know, Google clicks, and all. We do all that for them, so they do a good job. You know, we always just say, you know, your Facebook marketing, Google marketing, all those things, that should be, hopefully can take care of 35, 40% of your company. And go get the other rest from there, right?
That's a lot. I mean, you're the first person who's telling me that. I've spoken to 9 business owners and they don't really focus too much on Facebook and stuff. They're all very like hands-on, you know, they're going and doing the marketing type of thing.
Here's my thing. Facebook marketing, Google marketing, YouTube marketing, it's a passive marketing strategy that can get you clients. So why don't you want to concentrate? You know, if I spend, let's say for example, here's a good example. My Florida home care company, we spend an average, you know, per client acquisition is at $330 per acquisition of a client for home care services. After we do Facebook marketing, after we're doing all these stuff on Facebook, I'm getting one client every time I spend somewhere around $300, close to $350, we'll say. A lot of people say, well, that's a lot of money. My thing is that money I can make back in less than a month. If this client stays with me for so much, that's pretty good.
His lifetime value.
It's a lifetime for non-medical. So I don't mind spending $10,000, $12,000 a month for a home care client if I'm increasing my returns.
Right.
Also, with Facebook marketing is the part that you start branding your company and you start getting to know people.
Right. Brand your company, get to know. I completely agree with you. No, this is a very good advice. Like I'm gonna.
You know, what is 3 to 5 cents per view of your ad? If the bigger companies are using Facebook marketing, YouTube marketing, they know something that you don't. So for a small company or local mom and pop company not to believe in it when the cost is still low, pay-per-click ads 10 years ago was at $1 a click. Now for home care, it's at 15 to 20 per click.
Right.
And that's not even a conversion. That is a click. So it's more expensive. Facebook is going to be that price in the next 5-10 years. We're seeing that go up now. What I was paying for Facebook ads 5 years ago to what I'm paying now has been doubled.
Right.
So that's where they really need to look at. Are they doing that? If you're not going to get returns, then how are you doing right? The funny part is, if they, like, even for example, here's a fun fact. Like, go back to that to Google screen where we did a search for home care in Wichita, Kansas. Right? So always best care, for example. Let's go down a little bit. So see, I'll give you an example. The fact that caring.com is ranking #1 and they're not even a home care company, that shows right there that there's so much room for SEO in this area. Like if you go, it's all caring. First Light's doing a good job with that. Now go all the way down.
That's hilarious.
Go all the way down. There should be some ads. See, here's a fun fact. No one is putting ads on Google right now in that area. No one's
Right.
doing ads because there should be ads in the bottom. So
Right.
if nobody's doing pay-per-click ads, if you're a new company and you're not ranked SEO yet, you don't have a search engine optimization where you're ranking on the first page of Google, which takes about a year, then you should put ads right now in that area and you have a likelihood chance of getting clicked on.
Look at this, man. Cleveland.
See,
No ad.
Cleveland, they're doing ads. So go up, for example. See, there's ads right there. Up, go up a little bit more, up more.
Oh, right.
There's
Sorry.
your ads. Now here, watch this. See, always best care right now. Click on that right now. We're gonna make them spend some money.
Right. That's what I was thinking. Which one did you say?
Always do always best care. Okay. So here's the fun part, right? So they're getting returns from this. They're getting results from this because they're advertising whatever. But here's the biggest mistake. They're doing right now a free consultation. Talk about that. If I would do a pay-per-click ad, what I would do in the first click here is saying, hey, here's 5 steps on how to prevent your mom from going to the hospital. I would start educating people about on that first click. Let me give you some education. If you want this information, click this right here. Because first of all, you're understanding people that they click home care because they're looking for home care for mom. But now I'm going to give them more education to really give them to want to then send me their email, their phone number. When they log in there, then I say, hey, listen, one of those top 5 techniques is for you to actually talk to a home care specialist. That's going to be tip number 3. Okay. So guess who's the home care specialist I want you to talk to? Me.
Yes.
That's how you prevent mom from going to the hospital. Then we can start having a conversation about price, about services, about that. So it's okay to do, so Always Best Care is still getting some clients because they're doing those because people are searching. But imagine if you provided educational-based information that makes people want to do the same thing. It goes to the same thing when we do Facebook ads. I'm not talking, see, most people that does ads, they want to sell. Sell. Give me a referral, give me a patient. What I would do when I do Facebook ads when it's to that is the same thing. 5 steps how to prevent mom from going to the hospital, right? 3 things to choose for this. 2 tips for that. Give some information, brand your company. You're talking about earlier is how do I reach out to people? One thing I would do, I would create a blog, a website that provides information to people talking about senior care. Advertise that in Facebook, because this is in the beginning section to try to kind of getting to know people. And when people start learning about your company, it's not even part of your home care company, but now you're able to start gathering data on who needs care.
Right. Create a blog / maybe website.
So what I always tell people is, hey, what can you do? Just give me a second, okay?
Yeah, please take your time.
How's your day? Fine. How's your day?
No, you're on mute. You're on mute, man. You're on mute. You're on mute.
I have a client right now. I'm sorry. Let me handle this real fast. It's an emergency. So
Okay,
let me call you right back.
Can we connect again later? Is that okay?
Yes, later on today we can connect. I'll send you a message, okay?
Okay. Thanks a lot. I really appreciate all your help. By the way, I'm going to get back to doing some research again, but I'll contact you soon. Again.
Sure.
And yeah, thanks a lot, man. Appreciate it.